What if you were unable to make an important healthcare decision for yourself? Who would speak on your behalf? Here to talk to us about the importance of having an advance directive is Kelly Markham with Baptist Healthcare. Good morning, Kelly. Thank you so much for joining us.
Well, thanks for inviting me to be here.
Well, first things first, tell us a little bit about yourself and what your role is at Baptist Hospital.
Okay. I'm the palliative care coordinator. I'm a licensed clinical social worker, and I've been at Baptist twice, this time for about 6 years. And in 2009, we started the palliative care program at Baptist, and it has grown through these 6 years to include now myself, a social worker. We have another social worker, a nurse who specializes in pain and symptom control, and then a physician as well.
Great. Sounds like you have a pretty good team.
We do. We do. We're thrilled with our team. Yes,
That's
we really
good.
are. Yes.
Okay, so you're here to talk about advance directives,
Right.
and some people may not be familiar with what that means. Tell us a little bit about that.
Okay. Well, Florida has a statute, and most states do, that provide for an advance directive. And that basically means a person can state in advance what they want, really to guide decisions about their health care. And advance directives, I think there's a lot of misconception out there. Advance directives only cover about 3 situations. When a person's in a persistent vegetative state, if they have an end-stage condition, or if they have a terminal condition. So it allows people to state what they would want to give their family guidance about if they were ever in the future in that sort of a situation.
Well, in situations like this, there are a lot of terms that are kind of floating around: power of attorney, living will, but there is a difference between the two. Can you kind of explain what we're talking about when comparing the two?
Actually, in Florida, we have 4 advance directives. The living will is in which a person can state what kind of treatment they want or they don't want while they're living. Okay, so that's where the term living will comes from. People sometimes confuse it with a will, but no, it's regarding health care. Then a healthcare surrogate document is often with a living will in the same document. And that's where a person can designate the person to make their healthcare decisions if they should become incapacitated. Okay, and that's sort of a legal term that we deal with a lot of times. You know, they're not incompetent, they're just incapacitated for the moment. It could be due to a serious illness onset, or it could be to a medication type reaction. So, but if they're incapacitated. So those 2 things usually are together. The durable power of attorney can include both healthcare decision making and business decision making. Those are the 3 we'll probably be talking about today. There's also the do not resuscitate, and that really comes more at the end of life when a person most likely has an end-stage illness.
Well, and these are things we don't love to talk about or even think about at all, but
You're right.
it's important because, you know, we were talking a little bit about some stuff going on before the show, and unexpected things happen all the time.
Right.
Can you explain to me why it is important to have a power of attorney, for example?
Sure. Well, you know, you've got to do that while you have capacity. You've got to do those things, and we don't like to think that anything's ever going to happen to any of us. Nobody likes to think about it. But really, in my opinion, the time to take care of these documents is when you're not in a crisis. I tell all of our new employees, I do orientation every 2 weeks, and I tell our employees, you need an advance directive. You need a healthcare surrogate, because you need to designate who you would trust to make your decisions in the event of something unexpected. I think in our society, we don't like to talk about these things. We don't like to think about these things. They're not fun.
Right.
But I've seen so many situations where people have regretted not doing those advance directives when they had the opportunity.
Well, and with you being on the show, I'm sure viewers are going to think, oh, I've got to get this done now. This has really encouraged me and challenged me to do something to make sure that I have plans in place if something crazy does happen. So how do you start the process of the power of attorney and all that other?
Okay. Well, the living will and a healthcare surrogate can be witnessed by 2 people. They do not have to be notarized, but they cannot be witnessed by the person being designated as the surrogate, and preferably you have one non-family member that is witnessing them. So a lot of times in the hospital, we will have staff members that are willing to witness those documents if people want to do them in the hospital. A lot of home health agencies and hospice agencies will facilitate that as well. Now, the durable power of attorney does require a notary. And so a lot of times in the hospital, because that involves both healthcare and business, we might not be as involved in those, but an attorney can certainly help with that. And usually you can find that document somewhere like Office Depot or online. Now, the healthcare surrogate and the living will are usually available at the hospitals free of charge. They're also on the myflorida.com website. You can just type in healthcare surrogate or living will, and there is a Florida statute approved form that people can download for free. We at Baptist, and I think all the other hospitals in town, are willing to provide the documents we have free of charge to people so they can call us or come by, and we're happy to provide them.
Well, and isn't the internet a wonderful thing?
It is.
But it's also kind of scary to think about all this information is accessible online and at your fingertips.
Yes.
So it's great that Baptist actually provides that information, because navigating sometimes what's safe and what's, those kinds of things.
Absolutely.
So that's wonderful. But you alluded also to a health surrogate. Could you kind of explain a little bit more what that is exactly?
Okay. So if a person, or when a person becomes incapacitated through either a serious illness or an accidental situation, that surrogate is the person they trust to make their health care decisions for them. And a lot of people think, well, I'm going to ask my spouse or my child, and those are great sources to do that. But when a person is thinking about who they want to be their health care surrogate, they really need to pick the person they believe will make the decisions that might be difficult in difficult situations.
Emotionally, I'm sure.
Yes, very hard times. And as important to me as appointing a surrogate on paper is having a discussion with the surrogate as to what my wishes would be. Let's say I am in a persistent vegetative state, or you have to make decisions about whether to artificially feed me. What would my wishes be? Because the surrogate is really charged with substituted judgment, making the decisions the patient would make. We always, when we're talking with patients and families, we'll say, okay, let's just envision that your loved one is sitting here in a chair. They're not in the ICU. They're well able to understand the situation that we're talking about. What would they tell us? What would their guidance be in this situation? So that's what we try to help people get to, because it's a very emotionally charged, often very sad situation.
Absolutely. Well, Kelly, thank you so much for joining us. Your number's actually on the screen, so if folks do have questions, which I'm sure that they will, they can reach you. But thank you so much for joining us. We really appreciate it. It's great information.
Well, it was my privilege. Thank you so much.